Hello, and welcome back to this introductory video series on foundational skills for psychedelic-assisted psychotherapy. Today we're going to talk about set and setting, often referred to together, set and setting, and the related concept of the container. So many of you have heard the phrase set and setting and know that it's a big part of how we think about the frame for working with psychedelic-assisted psychotherapy. Set and setting is really the reason why an experience on a psychedelic, say at a party or in an informal setting, can be wildly different from an experience in a clinical setting, a psychedelic-assisted psychotherapy setting, even with the same medicine at the same dose. So why can one experience be frightening or arbitrary or just feel more recreational, and another experience with that same medicine at that same dose can feel profoundly healing or meaningful? A lot of that has to do with set and setting, and we know this from the data as well. We also know that set and setting, for similar lines of reasoning, is relevant for scary or negative outcomes. You know, the idea of the bad trip. We know that that can be really dramatically mitigated by paying attention to set and setting. So set in this context refers to mindset, and setting, obviously the setting or the context, especially the immediate environment of the session. So I'm going to just break those down a little bit. So for set, we are talking about mindset. This includes the general emotional state of the person going into the medicine session itself that day, the day of the session. This includes their beliefs and thoughts about the treatment, their hopes or expectations, how safe they feel it may or may not be, their anxieties around it. It includes how they feel about the setting, is it a hospital setting or where are they, what's the location, how they feel about the providers that are going to be in the room with them. All of those things can affect the mindset. So expectations and the sort of stories they may be telling themselves about what to expect or not. And another piece that's really relevant for set is things that are on the mind of the person in general. So if something really dramatic or upsetting is happening in their personal life, or maybe even their work life in the days leading up to the session, that may be on their mind. Anything that's somewhat in your mental space can be relevant for set, can show up in the psychedelic experience in some way, or shape it or frame it in some way. So one of the interesting things about psychedelic work is that the psychedelic space itself is, as often described, powerful and can be transformative. It can be very insight promoting. Interestingly, it is also somewhat shapeable in the sense that the mindset, the set and setting pieces, but here mindset that you go in with can affect to some degree what shows up in the experience. So this is important to know. I often tell people to pay attention to immediate events going on in the day or two, especially the day of a medicine session that may be on a person's mind. Did they get a phone call on their way to your office that the babysitter may not be able to pick up the kids and they have someone filling in, but they're not sure? That's going to be relevant for how comfortable they're going to feel going into an altered state. That's going to be something on their mind. Are they coming in to do a medicine session with you and their husband is going to get their biopsy results that day? Or, these are the sorts of things to track and pay attention with the client. None of these things are absolutes in the sense that you cannot do the session, but it is your job to help the client track what those things mean and how safe or appropriate they feel going into an altered state experience. If there's something going on in their real life in an immediate sense that they need to either stay conscious of, or that they are going to feel worried that they may need to stay conscious of. So they won't really be able to relax fully into the medicine session experience. So that would be an aspect of tracking set, right? So we've talked about overall sort of emotional state, beliefs and expectations about the work, feelings about their relationship to the people who are going to be in the room, people who are doing the work itself, and just immediate influences that are in their sort of mental field, or things that they're aware of that are on their mind. So this being said, a slight counterpoint to this would be to just drop in to the conversation. If I'm talking to you guys as trainees, this does not mean that the person should go in with their mind like a blank slate or something like that. Once in a while you'll hear that. That's ridiculous, really, because it's impossible, and also that's not warranted. People are coming into psychedelic-assisted psychotherapy treatment usually because they're dealing with pronounced mental health diagnoses and symptoms, things that they're struggling with. By definition, they're not going to have a blank slate mind with no distressing content or anything like that. And so if the client somehow has the impression that they can't be thinking of anything that's bothering them, or it'll, create a negative experience, that's not the case. That's taking that concept a bit too far. So to state this a little more in a summary sense, it's your job as the therapist to have a conversation with them around this concept of set and setting, the mindset that they're going in with. But it is okay for them to have be struggling with things, and it's okay for them to have some nervousness about the session. It's okay even that they have a lot going on in their lives. What's important to know for both of you is that may show up in their medicine session. And if some of that shows up, that may be good. That may be the sorts of things that you want to be working with. It may be what the client needs to work with. But if all of that is going on in their life, they have pronounced symptoms, or they have real things they're struggling with that they need to work with, that's somewhat what we would expect in this kind of work. However, if, like I said, on the way there, they get a call, for example, that their kids don't have a babysitter, that's something that's going to keep them from really dropping in because of an immediate concern. So track that and pay attention to that. And then track how they feel about the medicine itself. Some anxiety, like I said, is okay. It's pretty normal, actually. But what are their expectations? Like, do they feel that it will be a positive? Or are they deeply afraid of it or something like that? Those are things that one should have checked for in preparation. And then checking how they feel about the sort of trust that they have in the safety of the experience and so on. I think that covers most of my notes for set. So let's talk a little bit about the setting piece. Setting generally refers to the actual room, the building, the location that the work is being done in. This could also include the greater context of the location. Is it a hospital, or is it like a sort of rural or like nature-based environment, or what sorts of feelings do they have about the sort of the clinic as a whole? And then the individual room that this is happening in. This includes how comfortable the room is, who's there, are all the people that are in the room people that the client is familiar and comfortable with? Does it feel professional and safe? And this is a piece that people speak about often, which is true, is decor or music or symbolic objects, art. All of these things can influence the way the person feels in the environment. I'm not going to speak today about, what to use in the room. That's a little bit of a different topic, but just stating that that's part of setting. So that's the appearance of the space. Having windows or access to natural settings, for example, could be an aspect of setting that would make people feel, that may influence the way they feel about the experience. Sounds and interruptions. This is if there's going to be medical personnel coming in and checking on vital signs or so on, it's important that the person has met those people ahead of time, feels comfortable, and knows what those interruptions are about. In other words, that they've been walked through that in the preparation phase. And so that's an aspect of the setting, right? If a person is going into an altered state experience and then are surprised by things they weren't expecting, or someone comes into the room that they weren't prepared for, that can be quite jarring. So that needs to be you need to make sure that that's not the case. Okay, so that's a very brief overview of what is set, what is setting, and I spoke a bit in the beginning about why they're so important. It's critically important, and so it's your job to either provide this or help track this with the client, depending on what you're talking about, and make it part of your dialogue in the preparation phase and checking in with the client on the day of their first medicine session. So there's a related concept that you may often hear called the container. The container covers a lot of this same territory, but you'll often hear us say things like a provider needs to set a safe container, or this is the container that was provided for the work to be done in, and so on. So container covers set and setting plus a few other things. And really, I think of container as what it is our job as a provider and as a clinic to provide. So it is my job in my clinic with my staff to create a safe container. So this may be outside of the things that the client immediately sees in the sense of set and setting. This could include your safety policies and protocols, how your procedures are in the sense of how you take clients through the preparation phase, how you prepare them, a lot of back policies around safety. You know, if this happens, do you have safety mechanisms in place for different outcomes? What kinds of professional coverage and physician coverage are in place? It can include, it's the system that surrounds the treatment and the fact that, what's in place to provide for the preparation phase, the medicine phase, and then also how much you follow up with the client after the session, which I think you guys have heard who've been working with me, I think is a big safety piece. How that is held, what are the systems in place for that? That's the container. So taking the client all the way through their initial sort of intake visit, all the way through to their completed full integration phase and feeling safe to sort of launch back into life and are like officially discharged, which can be a long amount of time. What are all the things that you're doing to make sure that that is done safely and thoroughly and so on? That's the container. And then contained within the concept of the container is you tracking and providing for appropriate set and setting. So I hope that this has been helpful. It's a brief overview to some vocabulary that's really important. And so as we go on in this lecture series, you'll hear me refer to set and setting a lot, ways to optimize that when we're actually talking about different stages of treatment. Today's just been a little bit of an introduction to what those concepts are and what is contained within them. So I hope that's been helpful, and I'll see you for the next one of these introductory videos. Thank you.